Good morning. How's everyone? All good to go? Excellent. We have no new cases of COVID-19 in Queensland overnight, which, given the sheer number of risks that we're monitoring, is an excellent result, especially given that we've had 13,081 tests. We do have some more information to share regarding the case that was notified yesterday. The Chief Health Officer has received back the genome sequencing for their virus, and it is linked to another returned traveller in the same hotel quarantine hotel. You'll have seen that there's a range of new contact venues that have been listed, and I just want to say what amazing science it is that our health detectives are able to do this kind of linking. It's a great series of tools in our arsenal to fight against COVID-19.
So no new cases in Queensland overnight, which is absolutely fantastic. And thank you to every single person who's come out and got tested. That's what we need to continue to see. Please, anyone with any symptoms at all, anywhere in the state of Queensland, would you come forward as soon as possible and get tested? And that way we can pick up cases and chains of transmission as early as possible. So yes, I got the whole genome sequence result for that man who travelled from China and was in hotel quarantine, and he has exactly the same sequence. It's identical with no SNPs different, with a traveller who returned from South Africa via Doha. Now, there are now 7 people in that cluster. So we had that person come back as part of a family group, and they went into one hotel. Then we had some others in another group who went into a different hotel, and they've all become positive subsequently and have the same genome sequence. They were all on the same flight from Doha to Brisbane that arrived on the 8th of July. And now we've seen this gentleman, who was on the same floor, in fact in the room opposite to one of those others, has contracted the infection from that person. So he was left quarantine on the 12th of July, and then he developed symptoms on the 15th, so that's why we've contact traced back 2 days to the 13th of July, and you will have seen all of those venues up on our website. It's really important that people check our website. If you've been anywhere in Brisbane or the Gold Coast since that 13th of July at any time, please make sure you every 24 hours check the website, because we do get more sites as we talk to these cases that they remember where they've been, and we put those sites up. That's very, very important as we go forward. So this gentleman was fully vaccinated, and we do have some serology back that suggests that he had antibodies. Despite that, so the vaccine had worked, but despite that he still got infected. It took a while for his infection to declare itself, so we had that initially indeterminate result with a very, very high CT level. Then we got the confirmation that yes, he did have that infection. So I do think his infection is unlikely to have spread to anyone else, but I am still very, very worried about those other 2 individuals, one who came up from Sydney to Ballina and was picked up at Ballina and then came into Queensland with that other person, the Qantas regional flight crew member. So they have been out and about in our community while infectious for a while. So it's really important. I can't overemphasise it. Please, could everyone keep wearing their masks? Because I genuinely think that has made a difference for Queensland in not seeing large cases out of any of these infected people. Come forward and get tested if you have any symptoms at all, and maintain that hand hygiene. All of those things add up and make a difference. Thank you.
Fantastic news with no new cases overnight, and much of this is due to the great work of Queenslanders following the directives, including across those 11 local government areas in southeast Queensland where they continue to wear the masks. So thank you to everyone. Of course, keep coming getting tested. Over 13,000 tests in the last 24 hours. What we have seen with this most recent case is 6 other people getting infected from one individual. 5 of those on the same plane and 1 in hotel quarantine. So it shows how infectious the new Delta strain is, which we are now seeing as the dominant strain across the globe. And of course we will look at the CCTV footage in relation to that hotel, but we are confident more than likely this is going to be something that's been transferred through the air in that hotel because of the nature of this virus. I also want to say we are aware that we expect some announcements from Victoria and South Australia today around their lockdowns. We will await any formal decision of those 2 jurisdictions before we make any decisions as to any changes to travel from Victoria and South Australia to Queensland. So I understand some figures are out this morning for Victoria, which look very positive, but we will await to see what the decisions of those 2 jurisdictions are, and if they lift their lockdowns, what the level of restrictions are going to be going forward to figure out where we should go next and update the people of Queensland after that. Thank you.
With the start of the week yesterday, the working week, we saw increased activity at our borders, which is not surprising. So 4,330 vehicles were intercepted at our road borders, 55 turned around, only 1 person in the quarantine. At our domestic flights coming in, 635 persons processed, 11 refused entry, 153 into quarantine. International arrivals comprised of 159 persons. And we handed out 18 masks yesterday, so the message is going to be consistent. The masks are still in play for us for the remainder of this week at least. Please do carry them and wear them where you need to. We did have to issue 2 penalty infringement notices for persons coming across road borders who provided false declarations, so they've been fined each $4,135. Can I just conclude by saying the investigation into the duo, the balliner, so the flight attendant and her associate, we're satisfied that we've got all the information we need to undertake comprehensive contact tracing, and our other investigation, any breaches, will be concluded later today, and we'll be able to advise what happens with that then. Thank you.
Any questions?
Sure.
Obviously, we'll hear about the outcome.
Look, the way it works for us is the investigation is done at an operational level, and the decision to prosecute or otherwise is made by our operational officers, and I'm waiting for their outcome and advice from them. I'm not going to preempt what those officers decide.
So were they in a relationship?
I can't comment on that.
Did they know each other before the travel?
Look, there's a lot of details into that in terms of their associations and whom they know that I don't have the detailed knowledge around, and nor would I probably get into that, including any associations they may have that don't relate to our investigation.
Is their level of cooperation increased?
We're satisfied that we've got all the information we need to undertake the contact tracing.
So were they helpful in the end, or did they do it?
They provided the information we needed. Thank you.
Dr. So just to be clear, there's a series of people who you believe have been infected on that plane, and then there's this gentleman who you believe has been infected in hotel quarantine.
That's
Which
correct.
hotel was
The Amora Hotel in Brisbane.
Are you worried others in other hotels infected?
Well, it's a while back, so of course we'll now go back and contact trace all of those people who are on that floor at the time of concern and see whether there's any other positives out of it. But it is going back a bit. Yeah.
How many people were on
Yes. So he was in a room opposite to one of the travellers who came from South Africa who had that genome.
Is there any indication at all as to how it may have spread in terms of doors open? Or...
Yeah, well, they were in opposite rooms across a corridor, so that's a risk. We know that, and we're now looking at CCTV footage to see whether doors have been opened, close to each other in time frames. We're also looking at testing regimes, whether there's a risk there. So all of that work's happening at the moment.
Yesterday you mentioned a sort of timeline of him leaving hotel quarantine, initially getting symptoms,
Yeah.
and then getting tested. Are you able to clarify just when he was actually tested after the first
Yeah.
dose?
So he was tested on the 23rd of July, but that test came back with a very, very high CT level, so we were waiting for further information before determining whether or not it was a case, and we got that on the 25th of July. That's when he had a test that had a CT value that means that there was a significant amount of virus there.
Was there a bit of an oversight on the part of the GP who first saw
No, the GP saw him on the 23rd and was very astute and organised the test, so the GP was first class.
Well, I think yesterday you mentioned that they went to the GP on the 13th.
No. He developed symptoms on the 15th, and because we always go back 2 days to determine infectious period, we went back, but he didn't go and see the GP till the 23rd, and the GP was very good.
Oh, sorry, can I just ask you one more question? You just mentioned before you're checking CCTV to see whether testing may have spread it.
Well, no, to see whether the doors of the rooms were opened in a time frame that might suggest that's when transmission occurred.
And have you got tests back on his close contacts, family members?
Yeah, they're all negative.
So I've got, agriculture workers in New South Wales, for example, to work in. Are you comfortable with
Yep,
that arrangement?
yes. So we've always had that arrangement. I mean, we've all been doing this now for 18 months, and it's really important that agriculture continue, and we know where they've been and they're low risk. So if we think where we've seen cases in New South Wales, they've been in towns. And I got this morning sewerage results from New South Wales, as I do every single morning, and regional New South Wales is clear. So that's reassuring for that northern border zone and reassuring for regional New South Wales.
Now it's